Hello, you guys. Dr. Vidal here of Pure Plastic Surgery, and we are back with Tuesday Tips with Dr. Vidal. We do this every Tuesday, or I try to do it every Tuesday, that we meet on an afternoon to talk about different topics in plastic surgery and answer your questions. And today, let's talk about implants. I know there is a lot of information about implants, and sometimes tends to get a bit overwhelming when you're trying to decide what size, what implant, what should I put. So let's talk a little bit about all of those things. Like, let's dissect it down. So each of the categories, what are the options, and what means actually each of those words that we use: profile, cohesiveness. What does it mean? So then you can make an informed decision and choose your implant. So let's start with types of implants. We have two types of implants in the market: saline versus silicone. What is the difference? The difference is on the inside. Both implants are actually made of silicone in the shell. So I'm going to show you here. This is a ruptured implant. I ruptured it for demonstration purposes. And this is a gel implant. But you can see that the shell, the covering of the implant, it's a very thin cover, and in both saline and silicone, it's made of silicone. What differentiates both implants is what's on the inside. So this one, you see, it's gel, it's a silicone implant. And if it was of saline, it would clearly be deflated, because saline is basically water with salt. So if it ruptures, it deflates instantly. So what are the differences between them? That's one of the main differences between choosing a silicone versus a versus a saline implant. Is if it ruptures, saline, you would know right away, but meaning that you will know right away. So you will be asymmetric until you get surgery to fix it, because one is going to deflate and the other one will stay in its shape. The silicone implant, like you see on this one, they don't deflate because of the gel that's on the inside. So silicone implants have been on the market since the 70s, and they have changed. Done? Okay, yo llamo yo. No, sí. Conditions, and it was taken off the market. The companies changed the gel, and they changed what is called the cohesiveness of the gel. What does that mean? Cohesiveness means what the silicone sticking to each other, making it more thick. So you see here, and that is the 5th generation now of silicone implants. And that's why they're called gummy bear implants, because the gel on the inside behaves like a gummy bear. It is not fluid, so even if it breaks, it's not going to deflate. And you see, even if I hold it like this, it may kind of pop out when I'm squeezing it, but once I put it like this, it goes back to its shape because of that cohesiveness. It's very sticky. So that means if it ruptures on the inside, the good thing is that it's not going to leak silicone in your body because it stays in its shape. But the downside is you're not going to know. So if it ruptures, you're not going to know until you get an ultrasound or an MRI and you see the rupture. If it's ruptured, the indication it is to change it. Why? Because even if it's not leaking silicone like fluid and absorbing it in your body, this gel will still create an inflammatory reaction in your body, and not something acute, but in the long run, you see patients that start complaining of more pain in that area, may increase the risk of capsular contracture, inflammatory reaction, okay? So that's one of the main differences. The other main differences is on the rippling effect. What is rippling? You see the implants that I have here always have a little bit of a fold in the implant. And this, when you go like this and I hold the implant and I squeeze it, you see those creases and folds that form on the implant. That's called rippling. The gel tends to ripple less. Saline, because it's water, the density of what's inside is less, so rippling is higher. So sometimes, especially if you're very thin and you don't have a lot of breast tissue, you may see that because the rippling effect may translate to your skin. So you may see rippling. So if you are very thin, don't have a lot of breast tissue, and you are concerned about rippling and seeing rippling, then it's better to use a silicone implant, okay? The other is the feel. So silicone is gonna feel more like a natural breast tissue. Thicker, more like softer, squishy. Saline is gonna feel like a water balloon, okay? It's basically that, okay? So it doesn't feel as natural. There's a lot of people that have saline implants and say, I feel them very natural, because if you have a lot of breast tissue covering your implant, what you're actually palpating is your breast tissue, okay? But if you have an A cup, very little breast tissue, and you put an implant, then the majority of what you'll be feeling is the implant, and that is the difference, okay? So if the feel is actually something very important to you, and you feel, and you want a more natural feel, then silicone, okay? So those are the three main differences. Both are equally safe, FDA approved, so both are very safe and good options if you want to. The majority of my patients, the majority of implants that I personally put, silicone implants, because of the less rippling and the more natural feel, okay? There's another difference for younger patients. The FDA approval for saline implants is 18 years old, okay? So FDA approves the silicone implants at 18 years old, silicone implants at 22 years old, okay? So that's another difference.
You can say that again?
Yes, so FDA approves the silicone implants for patients older than 22 years old, and FDA approves saline implants for patients older than 18 years old, okay? Let's go about the shape, okay? So all the implants that you see here are round. So I usually put round implants. I don't use anatomic. Anatomic means that the actual implant, instead of being round, is flatter up top and rounded up the bottom, like more of a breast shape, okay? The problem with anatomic implants is that they may flip. And if this flips, that's gonna look very odd, okay? If this flips and this is on the top, you can imagine. So that's the main reason why I don't use anatomic. The main reason actually is because to use anatomic, we have to go to this classification now. To do anatomics need to be textured, and I don't use textured implants, okay? Textured, I only use smooth implants, okay? So that is on the capsule of the implant itself. So we were talking about the shell, and you see this shell is smooth, okay? So textured implants are you have to put an implant that has some texture, so the body kind of creates an inflammatory reaction that holds that implant in place and avoids it from flipping around, okay? The problem with textured implants is that in the last few years, we've seen, unfortunately, a type of cancer associated with textured implants, and that is called breast implant associated large cell lymphoma. So it's BAALCL, okay? So because of this nuisance associated with textured implants were removed from the market in the United States, and they were actually recalled. So if you had textured implants done, probably had an email or a letter sent in saying that those implants needed to be changed, okay? None of my patients have ever gotten textured implants, because since I started training, all I've putting in smooth implants, okay? So none of my patients have to worry about that, but if you had implants done, 10, 15, 20 years ago, you have to check what type of implant you have. And if you do have texture, the recommendation is to change them, okay? So, smooth implants, and because it's smooth, we need to put them round, so even if they flip around, we keep the same shape and we don't end up with an odd shape, okay? So let's go to the cohesiveness. So I talked a little bit about that, right? The cohesiveness is the ability or the gel sticking it to itself, making it a gummy bear and not fluid leaking out, okay? So this is a cohesive gel. So the amount of cohesiveness is going to determine how thick or hard is the implant. So I am going to talk about Allergan implants because that's the one that I use. But Mentor and Sientra, which are the other two companies that sell implants here in the United States, also have similar classifications of different cohesiveness in their implants, okay? Again, I am going to make references to these three names because those are the names that are describing the Allergan implants, which are the ones that I use, okay? So this here are the three types of cohesiveness that are available at Allergan, okay? So the responsive gel is the softer one, is the less cohesive, softer gel. So if you can see here, this gel or this implant is softer. If we go to the middle classification, is the soft touch. It's a little bit harder, but still soft implant. And the cohesive gel is the harder implant. When you touch it, it's very subtle, the difference, but that gel is a little bit harder. Which ones are the ones that I put the most? The responsive, because that they tend to feel softer and more natural. If you want a more augmented look, what do I mean by that? Push-up, round, very high-profile implants, and that they stay like that, and then they don't change a little bit when you move around. There's like, you like those two rocks there? Then you want a more cohesive implant, that the gel is thicker, and then they feel and stay and keep their shape. That's a more cohesive gel, which is this one. The one in the middle is the middle ground, okay? It's a little bit harder, so it gives you that look, but still a little bit not that hard, that when you feel it, it's softer. So when you put a cohesive gel, and if you do, and I've heard this from a lot of patients, if you do have a lot of breast tissue and you put a cohesive gel behind it, you will notice the difference when you're palpating your breast tissue and the implant. Because the feel is going to be different. Your breast tissue is softer, and then you're feeling the implant that is harder, okay? And that's a cohesive gel. With a responsive or softer gel, I usually ask the patients and they don't notice the difference. It's like I'm palpating and I don't know what's implant and what is breast tissue because the gel is softer, okay? So that's why I usually go with a responsive, but there are some patients that want that look, they have a responsive inside and they want more and more a thicker look, then we can go with a cohesive, okay? With the breast cancer patients and breast reconstruction, I tend to go, when I used to do them, I used to go with a cohesive gel. The reason for it is because there is less rippling. So remember we talked about rippling, seeing that irregularities on the implant, and you can see with a responsive gel, because the gel is softer, you may notice more rippling than the cohesive. The cohesive is a thicker gel, so there's not that much amount of rippling, and you can see it here on the responsive versus the cohesive one.
Let me zoom it. Give me just 1 second. Just gonna zoom here. Yeah.
When I go like this, you see this like it wrinkles more than this one that stays more this shape. Again, if you have breast tissue over your implant, you're not going to notice that difference. You're not going to see the rippling. But if you don't have a lot of breast tissue, or like in a breast cancer reconstruction patient that they don't have breast tissue, it's just skin over the implant, then you may notice rippling more. With this, you may go with a more cohesive gel, okay? So let's talk about the other important, and I think one of the most important things to choose from the profile. The profile means how much the implant goes from the bottom to the outside. So how much it projects from your chest wall. So you see here, I have the three more common profiles. They're actually, again, I'm mentioning about Allergan, which is a product that I use, but Mentor and Sientra also have different classifications on their profiles, but they basically go from something lower to a higher or fuller, okay? So these are the names or the nomenclature that you're gonna see with Allergan implants. It goes a low is like a pancake, very flat implant, okay? I don't usually use either low or low plus. Low plus is a little bit thicker, but very flat implant, okay? So I don't usually use low or low plus. I use either moderate or full profile. This is a moderate profile implant. You see that it's flatter than the full. The full is a little bit more rounder. To make it more rounder means that the implant is actually narrower, so it projects more, okay? So when we go to an extra full, the implant is actually almost a ball. It's narrower and taller, which makes it almost a ball. The problem with the extra full is that it's almost a ball, so it tends to flip. The implants on the back have this information from the implant, the size, the type, the number of the implant, but if the implant flips, you may feel this on the front. This is placed on the back, so you don't feel it. But with an extra full being so round, it may flip. So that's why I don't like to use the extra full. So these two are my go-to implants, moderate or full. A moderate will give you more natural look. It's still gonna look fuller, but a more natural look, and a more push-up bra look, okay? And let me show you this patient. She actually had a moderate implant in and wanted to have a change to a high profile or a fuller implant. So I chose this patient because it's a very good example. So you see both in the same patient, okay? So this is a moderate implant, okay? She had a moderate implant from before. This is a 275 moderate implant. And you can see on the side view, it's still full, it's still giving a great shape, but you see that it's a little bit flatter on top, rounder on the bottom, which is the natural breast shape, okay? She wanted a more push-a-bra look, so we changed that. She also wanted more volume, okay? So we're seeing here a difference in two things, a difference in volume and a difference in profile, okay? So here, we went with a 520 cc full profile. This was moderate and this is full. Obviously you can see the change in size, right? These are bigger, but also take a look at the cleavage, and that's the main difference between the two types of implants. The cleavage here is like a push-up bra. This is not a push-up bra. This is a regular bra that she put on just to make the point, right? This looks like she has a push-up bra, but it's the same look. And on the side view that unfortunately I don't have it, it looks rounder in that upper pole like a push-up bra look, okay? So that's the main difference between the moderate and full. When, why, where, when to choose one or the other, it's up to you. This is a complete up to you thing. There are people that like more this kind of natural look, and a lot of my patients say, hey, if I want to push a bra look, then I'll wear a push a bra, and that's a good way of seeing it, right? But if you want that look even without a bra, then you would benefit from a full profile or a taller implant, okay? So these are the three main, but I use usually these two. The other important thing is when we're talking about augmentation and lift, okay? So if you need a lift, what is a breast lift? A breast lift is a procedure doesn't have to do with implants, actually. A breast lift has to do with the shape and the position of your nipple, okay? So there's something called ptosis, which is the droopiness of the breast. Depending on the amount of droopiness that you have, that's the procedure you're gonna need to correct that, okay? And the classification with breast ptosis is the association between your nipple and the fold below your breast or the inframammary fold, okay? So if your nipple is at the level or below the level of your fold, then your breasts are droopy and you need a reshaping or lifting procedure, okay? The reason why this is important is because an augmentation and a breast lift are actually opposite procedures. With a breast lift, we're tightening the breast, and with the augmentation, we're adding volume to the breast, okay? So that being said, there are a lot of surgeons out there that actually don't combine the surgery, okay? And the reason for it is what I just mentioned, because there are opposite forces working here. There is a way of doing the surgery safely, but there are some limitations to it. And the main limitation is how big we can go with the implant, okay? The other limitation is most of the time, 99% of the time, I'm gonna put a moderate implant there. Because the full implant, the full profile implant is gonna put too much tension on the closure and increase your risk of two things. Nipple necrosis, which is the nipple, because I have to move it up, rotate it up. If I put a tall implant, it applies pressure to that blood vessel and you can lose the nipple. That's nipple necrosis. Or the wound or the incisions may open up because of too much tension, okay? So if we are combining an augmentation and a lift, we're gonna go with a moderate implant, okay? That being said, if you want the very high profile look, we can still go and change the implant, but we have to wait 3 to 4 months for the nipple to heal, all the incisions to heal. And in the second surgery, 3 to 4 months after, then we can go and exchange the implant for a bigger, high profile implant to achieve your look, okay? Awesome. So I'll take some questions now.
Okay. Okay, let's start with this one. It has to be about breast, and is, can you get any procedure done while still breastfeeding?
So the answer to that question is no. The reason for that is because with breastfeeding, your breasts are constantly changing from morning to afternoon to night. So for me to evaluate your breast and determine what type of procedure you need, we have to wait for your breast to complete your breastfeeding journey and go to baseline. It engorges and goes down, engorges and goes down. We have to wait until it finishes that process and we see how much amount of droopiness you have. The breast tissue itself changes. It may get thinner, less dense, and we may need to be adding an implant. So the procedure actually changes. So it's better to wait at least 6 months when you finish breastfeeding for your breast procedure. If it's any other procedure, I recommend you stop breastfeeding before. The reason for that is because there is a lot of metabolic things and metabolic demands that your body's gonna need, that being in a process of breastfeeding that takes away from you to give to your baby, you need that metabolic demand on you to heal from the surgery, okay? And the medications from anesthesia and on the post-op opioids are gonna interfere with your breastfeeding anyways. So it's better to stop, but you don't have to have a time frame. The only procedure is the breast procedure. Wait 6 months.
What's the biggest size implant you can safely do with stage 2 lift?
That's a very good question, and it depends, okay? So the answer to that question is, if you already have implants, it depends on the size of that implant and the amount of lift that I have to do on that revision, okay? So if it's a very minimal lift that I don't have to rotate that nipple a lot, and you have, let's say, a 300 or 400 cc implant, we may be able to double that, for example. But if you need a big lift, then we have to see how big is the implant that you have, and how big are your, like, what is your goal to end up with. So there are a lot of things, and your measurements, because when you come, I'm going to measure you, and depending on your breast width, so implants go by the width of the implant. That tells me what size do you need, or what size would be better on you. Okay, so that is one of the most important measurements, is the breast width, to determine what size you should go with. But that question, it depends on the width, it depends on the implant that you have, if you have any, and the amount of lift that we need to do.
Okay, I think we're switching subject. Okay.
Switching topic, let's do it.
Topic. A little bit more weeks post-op, does
Okay.
standing for too long affect the BBL results?
Standing for too long, no. As long as you're not putting pressure to the areas still. So if you're 3 weeks out, you still shouldn't be putting pressure to the fat grafted areas. At this point, you may start using the BBL pillow, which is a pillow that you put under your thighs when you're sitting down, to avoid putting pressure to your buttock or hips. And that you can start using it at 2 weeks post-op. But still, no sitting on your buttock until you're 6 weeks out. But standing, moving around, that's all good.
Does the doctor do tummy tuck with implants?
Yes. So that is one of the most common surgeries that I do, actually. And it's what we call the mommy makeover. So the mommy makeover involves areas that are usually altered or changed with pregnancy, which the two most common, the breast and the belly. So the mommy makeover is a combination of a breast procedure with a tummy tuck. The breast procedure will depend on what you need, but usually a breast lift with implants, breast lift only, breast reduction, breast augmentation, any of that.
Can I get my eyebrows microbladed and still get a BBL?
Wow, that's a very good question. And still get a BBL? Yes, you have to just consider the healing period for the eyebrows, the swelling. Remember, you're going to be laying on your tummy. So wait at least a week. So the swelling and bruising and any reaction that you may have from the procedure, it's passed. But yeah, it shouldn't be a problem.
How's the recovery of a mommy makeover?
The recovery of a mommy makeover, so the first 2 weeks are going to be the most difficult ones. It's really not a very painful procedure. It's more timing and pressure, especially on the breast. So for the first 2 weeks, you're going to be walking bent over to protect the incisions. You're going to have drains in your belly. 2 drains I put on the corners of the incision. And for the first few weeks, you're going to be having massages, okay, especially in the areas of liposuction, where in the areas of the waist and flanks, that's included with the tummy tuck. But usually at 2-3 weeks, the drains are able to be removed. After the drains are removed, you're going to feel a lot better, but still there are going to be some restrictions. What are the restrictions? No heavy lifting more than 10 pounds. No strenuous exercise, and that is for 6 weeks, okay? So that's going to be the main limitations afterwards.
Okay, and this one, it's a very good one. Can you lipo back rolls during a tummy tuck and the front axilla bulge in an arm lift? So this will be a tummy tuck with an arm lift and back rolls lipo and axilla bulge lipo.
Okay. So there's a couple of things here. We can combine procedures to decrease anesthesia interventions, but there are a few things that we need to be considering to decrease the anesthesia time and also decrease the amount of time in the operating room, okay? So the combination of the tummy tuck with the brachioplasty is something that we can definitely do, but the state of Florida has a limitation on the amount of fat to be removed when we are combining an open procedure with liposuction, okay? So because we're in an office-based surgery center, and the limitation when we're combining that is 1 liter of fat, okay? So saying that the usual areas of liposuction with a tummy tuck is the flanks and waist area, and I usually reach the 1 liter limit with that, okay? So the back is gonna have to be taken care of in another procedure. A lot of people say, but if you're liposuctioning this area, are my back rolls going to be improved? Sometimes they do. It depends a lot on the extent of it towards the back, because remember, the surgery, I'm doing it when you're laying on your back, okay? So there is just a limit of how much I can reach with the cannula on the flank area towards the back. So it may improve, but it's not targeted to the back itself. So the best thing is to come back for a 360 lipo afterwards, and then I can target the back rolls specifically. The area in the axilla that's called the subaxillary liposuction area, that is a small area, so it can be combined with the liposuction on the flanks to the subax with the tummy tuck and brachioplasty. It is something that can be safely combined. Awesome, you guys. So thank you so much for the questions. I hope this helped answer some questions regarding the implants, what are the things that are available, and what are the things that you need to consider when you're thinking about a breast augmentation or a breast lift with implants. Usually we're using silicone, but saline is also an alternative. We're using round, smooth silicone implants. The cohesiveness, usually you're responsive, but cohesive is an option, and the profile either moderate or full depending on your goals. So more natural look or more of a push-up bra look, okay? So, and remember, the person that can help you the most to decide what size is your surgeon, because with your measurements and your goals, we can decide what implant size is best for you, okay? So thank you so much, and I'll see you next week with Tuesday Tips.